Eating at the right times matters just as much as what you eat. Seniors in the United States often eat heavy dinners late in the evening, meals high in salt, fat, or carbs that overload the kidneys before bed. This is one of the worst habits for someone suffering from nocturia. The timing of your meals controls how fluids move through the body. To reduce bladder pressure at night, large meals should always be eaten by 6 p.m., preferably earlier. The evening meal should be light and protein-rich with cooked vegetables and healthy fats. For example, grilled salmon with steamed zucchini and olive oil provides anti-inflammatory omega-3s, magnesium, and fiber without overloading the system. Seniors who eat their biggest meal at lunch rather than dinner see a measurable improvement in bladder function at night. Hydration must be front-loaded in the day. One of the most common causes of nocturia in elderly Americans is dehydration during the day, followed by a rush to drink in the late afternoon or evening. This pattern overloads the kidneys at the worst possible time. Seniors should aim to drink most of their fluids before 3 p.m. This includes water, herbal teas, and broth-based soups. After 6 p.m., fluid intake should be very limited, unless needed for medication. A warm herbal tea like chamomile or corn silk tea, a natural bladder-soothing remedy used in traditional medicine in Canada and the U.S., can be consumed in small amounts. Corn silk tea is particularly effective for calming irritated bladder tissue and can reduce urinary frequency at night. Protein intake throughout the day is critical for hormone balance. Many seniors, especially women over 65 in the United States and the United Kingdom, consume insufficient protein, which leads to muscle loss, hormone imbalances, and increased urination. Amino acids from high-quality protein sources help restore the production of antidiuretic hormone, ADH, and other regulators. Lean grass-fed beef, free-range eggs, wild-caught fish, and organic tofu should be part of daily meals. These provide essential nutrients like tryptophan and arginine that improve sleep depth and bladder relaxation. A hard-boiled egg with avocado and a sprinkle of sea salt in the afternoon can curb evening hunger, stabilize blood sugar, and help prevent fluid retention that would otherwise be flushed out during sleep. Herbal support is underused in Western medicine, but widely respected in clinical nutrition. The herb buchu leaf, native to South Africa but used in natural medicine practices in the United States, contains anti-inflammatory oils that calm the urinary tract. Horsetail extract, another traditional remedy, is rich in silica and helps tone the bladder muscles to prevent leaking or overactivity. Seniors who take these herbs earlier in the day, never late at night, report fewer bathroom visits after midnight. But the most widely available and effective herb for reducing nighttime urination is nettles. Nettle root supports prostate health, especially in older men, and reduces the urgency associated with incomplete bladder emptying. Nettle leaf can be brewed as tea or taken in capsule form with the main meal of the day. These remedies work slowly, but effectively when taken consistently. Food sensitivities also play a critical role. Seniors with undiagnosed sensitivities to gluten, dairy, or artificial sweeteners often develop bladder irritation as a secondary effect. Many people in the United States and Canada consume diet sodas, flavored waters, and low-fat dairy products daily without realizing that ingredients like aspartame or casein are inflaming the bladder lining. This inflammation leads to more frequent urination, especially at night. A 2-week elimination of common irritants like cow's milk, gluten, artificial sweeteners, and highly processed snacks can help reveal if there's a hidden trigger. Many seniors who remove these foods report improved sleep and fewer nocturnal bathroom trips within days. A powerful yet completely natural food for urinary calm is banana, but it must be consumed earlier in the day. Bananas are high in potassium, which helps regulate sodium and reduce fluid buildup. But eaten at night, they can actually increase nighttime urination due to the sugar content. The best time for seniors to consume bananas is mid-morning or with lunch alongside foods that stabilize their effect, such as nut butters or chia seeds. Potassium-rich foods in general, like sweet potatoes, white beans, and cooked beet greens, can help balance fluid levels and reduce kidney strain. These must be part of a diet aimed at stabilizing fluid elimination during waking hours. The gut bladder. Connection cannot be ignored. Seniors in the United States are heavily prescribed antibiotics throughout their lives, which destroys gut flora. This leads to systemic inflammation, weakened immunity, and overactive bladder. Restoring gut health with fermented foods like unsweetened yogurt, kefir, sauerkraut, and kimchi is one of the most overlooked solutions to nocturia. Good bacteria like lactobacillus can suppress urinary tract infections, reduce urgency, and support mucosal healing of the bladder. These foods should be consumed at lunch or early dinner. A spoon of sauerkraut alongside cooked protein or a half cup of kefir in the early afternoon can reduce inflammation without triggering nighttime digestion issues. Timing supplements correctly matters too. Magnesium, if taken at night, can calm the nervous system and help with sleep, but it must be in the right form. Magnesium glycinate is preferred over magnesium oxide or citrate for bladder support. Glycinate does not cause loose stools and has a calming effect on the bladder and muscles. Seniors in Canada and the UK often benefit from 200 to 400 milligrams of magnesium glycinate taken with dinner, helping them sleep deeper without sudden urges. Another supplement with strong research is beta-sitosterol, found in saw palmetto and pumpkin seeds. This plant compound reduces prostate swelling and improves urinary flow, especially in older men. When taken before the main meal, it allows for better bladder emptying, reducing the amount of urine left to trigger nighttime urges. Physical positioning during sleep also affects nocturia. Seniors with swollen ankles or fluid retention during the day, common in older Americans with heart issues or venous insufficiency, end up urinating more at night as gravity redistributes fluid from the legs to the kidneys while lying down. Raising the legs for 30 minutes in the afternoon or using compression socks during the day can prevent this fluid shift. A short walk after dinner also activates lymphatic drainage and can reduce urine production during sleep. There's also a deep neurological component. Chronic stress and anxiety, common in isolated seniors across the United States, causes surges in adrenaline that overstimulate the bladder. Cortisol spikes in the middle of the night push the kidneys to dump more fluid. Calming the nervous system through foods is just as important as calming the bladder. Bone broth, turkey, rich in tryptophan, tart cherries, and walnuts are foods that directly feed the parasympathetic nervous system, the system that controls rest, digestion, and bladder calm. These foods need to be part of the daily routine, especially in those who feel tense, irritable, or sleep in fragmented cycles. Another underappreciated cause of nighttime urination is poor sleep posture and apnea. Seniors with sleep apnea wake up to pee because of pressure changes in the chest that trick the brain into thinking the bladder is full. These people don't even realize they stop breathing dozens of times per night. In one large study in the US, over 60% of seniors with nocturia had undiagnosed sleep apnea. While foods can't cure this, eating light at night, avoiding alcohol and sedatives, and supporting the airway with anti-inflammatory foods like ginger, turmeric, and pineapple can reduce snoring and apnea severity. These foods help reduce mucus, inflammation, and swelling in the throat and nasal passages. Finally, one of the most underestimated causes of nocturia is emotional loneliness and cortisol disruption. Seniors, especially those in the United States and Australia, who live alone or lack emotional support, often suffer from shallow sleep and chronic cortisol spikes that trigger nocturnal urination. Food plays a role here too. Regular meals, eaten with other people, even virtually or in assisted living, help synchronize the body's circadian rhythm. Warm, home-cooked meals reduce stress hormones, soups, stews, and cooked whole grains, with comforting spices like cinnamon and cardamom, help anchor the nervous system. In fact, a clinical study in older adults showed that just eating meals with a consistent routine and calming flavors reduced nighttime wake-ups by 33% over 2 months. Important message. Nighttime urination, or nocturia, is a common but deeply frustrating issue for millions of seniors, especially in the United States, Canada, United Kingdom, and Australia. Waking up multiple times to pee doesn't just ruin sleep. It destroys energy, mood, heart health, and even brain function. But few people talk about the foods that can help prevent this. In this script, we will break down what foods actually reduce nighttime urination and why they work. Waking up several times a night to use the bathroom is not just a minor inconvenience. It's one of the most dangerous sleep disruptors for older adults. Most seniors who struggle with nocturia believe it's just a normal part of aging, but this is a lie. It's not just about the bladder. It's about hormones, inflammation, blood sugar, kidney function, and diet. A person in their late 60s or 70s from the United States or Canada might have been told by their physician that they need to cut back on fluids at night. That's partially true, but what they're not told is that certain foods eaten during the day, even during breakfast or lunch, can control or worsen nocturia. Foods can calm the bladder, improve kidney filtering, reduce inflammation, and even fix the hormonal imbalances that make you urinate more at night. One major reason seniors in the United States suffer from nocturia is excess glucose that spills into the urine. Elevated blood sugar during the night pulls water with it, which fills the bladder even if you haven't been drinking anything. That's why the first category of foods that prevent nighttime urination are low-glycemic, slow-burning carbohydrate foods that keep blood sugar stable. Steamed barley, steel-cut oats, and lentils are excellent for breakfast or lunch. These aren't sugary breakfast cereals or instant packets. These are whole, fibrous, slow-releasing carbs. In older Americans with prediabetes or insulin resistance, stable glucose keeps the kidneys from going into overdrive overnight. A small bowl of cooked barley with cinnamon and a pinch of sea salt can prevent the blood sugar spikes that silently trigger your bladder hours later while you sleep. Then there are foods that naturally lower inflammation in the urinary tract. Most seniors don't realize that an overactive bladder, especially in people over 60, can be partially caused by chronic inflammation of the bladder lining. Anti-inflammatory foods like wild-caught salmon, turmeric, pumpkin seeds, and cooked leafy greens are crucial. Salmon from Canada or Alaska is rich in omega-3 fats that reduce inflammation at the cellular level, not just in the joints, but even in the bladder wall and prostate. Pumpkin seeds, popular in the United States as a healthy snack, contain zinc and phytosterols that reduce irritation in the urinary tract and also support healthy prostate function, especially in men. Many older women in the United Kingdom and United States suffer from bladder pressure due to postmenopausal hormonal shifts. They lose estrogen, which affects the bladder's sensitivity. Foods that naturally balance hormones without synthetic hormone therapy are very helpful. Ground flax seeds, edamame, and sesame seeds can gently support estrogen receptors in the urinary system. They help tone the bladder wall and prevent sudden urges that lead to waking up at night. For older women with weak pelvic floor muscles, balancing estrogen with flax or sesame can calm the nervous system's reaction to bladder filling. Ground flax seeds are best consumed freshly ground, added to yogurt, smoothies, or oatmeal during the daytime hours. Salt balance plays a massive role in nighttime urination. Seniors in Australia and the US often suffer from either too much sodium from processed foods or too little due to low-sodium diets pushed by outdated medical advice. But low sodium can actually trigger the kidneys to release more urine at night. Natural salts like Himalayan pink salt or unprocessed sea salt, when consumed during the day in small amounts, can help regulate fluid retention. They support adrenal function and help retain water in cells, rather than excreting it constantly. This doesn't mean loading up on salty chips or processed soups. Those contain sodium chloride plus harmful preservatives. It means adding a pinch, of natural mineral salt to your food during the day, never at night. Then there's magnesium. This one mineral is constantly ignored, yet it plays a massive role in bladder function, nerve signaling, and relaxation. Seniors in North America are extremely deficient in magnesium, especially those on diuretics or blood pressure meds. Low magnesium levels cause the bladder to spasm. It causes the detrusor muscle of the bladder to misfire and send signals that feel urgent, even when the bladder isn't full. Foods rich in magnesium include cooked spinach, almonds, avocados, and dark chocolate, with at least 85% cocoa. These foods calm the entire urinary system. Consuming magnesium-rich meals during the day or early evening can dramatically reduce night urination by calming nerves and muscles. Cooked spinach with olive oil, sea salt, and garlic is one of the most bladder-friendly sides a senior can eat at dinner. There are also powerful foods that support kidney health directly. The kidneys filter the blood constantly, and any dysfunction can send more fluid to the bladder during nighttime. Cranberries are often pushed for bladder health, but we're not talking about sugary cranberry juice from the supermarket. Whole cranberries or unsweetened cranberry powder can reduce bacterial biofilms and inflammation in the bladder. But even more effective for kidney filtration are foods like asparagus, parsley, celery, and beetroot. Asparagus contains asparagine, a compound that improves kidney cleansing without overstimulating urination. Celery and parsley, when cooked into soups or broths, act as mild diuretics that work during the day, not at night, so the body doesn't have to dump fluid while sleeping. A celery parsley soup at lunch can reduce nighttime fluid volume by forcing earlier elimination. One of the most critical hormonal players in this issue is antidiuretic hormone, ADH. In younger people, ADH rises at night to stop urine production so sleep isn't interrupted. But in seniors, this hormone can drop or stop being released, especially in those with disrupted circadian rhythms. This is where melatonin-rich foods come in. Tart cherries, walnuts, and goji berries can naturally stimulate melatonin production, helping the brain restore its sleep-urine regulation cycle. Tart cherry juice concentrate, taken in the late afternoon, not close to bedtime, has been shown in studies from the United States and Australia to reduce nighttime urination due to both its anti-inflammatory and sleep-inducing effects. It helps the brain remember to shut off bladder activity at night. Caffeine and alcohol should be eliminated or strictly limited, especially in the late afternoon. These substances are diuretics and directly interfere with the bladder's ability to hold urine. Many seniors in the United States drink black tea, coffee, or even red wine later in the day without realizing they're forcing their kidneys to stay active through the night. Even decaffeinated drinks can contain enough residual stimulants to cause a problem. This doesn't mean a senior needs to stop enjoying coffee altogether. It means consuming caffeine before noon, hydrating well during the morning and early afternoon, and then stopping all fluids after 6 p.m., unless medically necessary. Fiber is another overlooked ally. When a senior is constipated, the colon puts pressure on the bladder, which reduces its capacity and increases urgency. Many people don't realize their nighttime urination is partially caused by bowel dysfunction. Foods high in soluble fiber like chia seeds, cooked carrots, applesauce, and psyllium husk can relieve pressure on the bladder by improving elimination. In a study from the United Kingdom, elderly patients with regular bowel movements experienced reduced urinary urgency within just 1 week. Constipation management is not just about digestive comfort, it's about full bladder control. Another group of seniors, especially men over 60 in the US and Canada, are dealing with an enlarged prostate. Benign prostatic hyperplasia, BPH, causes narrowing of the urethra, which prevents complete emptying of the bladder during the day. That leads to higher chances of nighttime urination. Foods that shrink or calm the prostate include saw palmetto extract, cooked tomatoes, rich in lycopene, green tea extract, and pomegranate. Lycopene in particular has been shown to reduce prostate size and inflammation in older males. Cooked tomato sauces or soups, especially homemade ones with garlic, olive oil, and herbs, are far more effective than raw tomatoes. Adding a small serving of cooked tomato to dinner helps support the urinary tract in men during the overnight period.